Investigation by News9 that has uncovered the lid on an operation in Bengaluru that is potentially harming mothers and expectant mothers. Now, the News9 special investigation pertains to the death of 5 pregnant women in Ballari, which created a huge controversy in the entire state of Karnataka. The cause of these deaths were attributed to the use of substandard IV fluids by government hospitals and negligence on the part of State Health Department over the use of IV fluid. Now, we have accessed documents that blow the lid off the case and perhaps will also shock you. News9 has continually, reported on the series of deaths of pregnant women. Alarmed by this, the government stopped the supply of a deadly IV fluid to the government hospitals. In addition, the health department has also instructed all district health officers not to administer the fatal IV fluid already supplied to patients so far. Let's also try and understand where did this deadly IV fluid really come from. The IV solution has been supplied to the state from a company in West Bengal since October of 2023. The solution being supplied to Bangalore from Darjeeling in West Bengal was being transported to the KSMLCL warehouse on Magadi Road in Bengaluru. From here, it was being supplied to government hospitals. As soon as the IV solution was brought to the state, a sample test was supposed to be done. However, the sample test was never done. 5 months later, that is in March last year, a sample test of the IV solution was finally conducted. From October to March of 2023, which is last year, 195 batches of IV solutions were supplied. It is mandatory, remember, to test every sample of every batch before supplying it to the hospital. However, only 10 batches have been sent for sample testing after 5 months of IV solution supply. So for 5 months, that IV solution was being supplied, was being used, and only 10 batches were sent for sample testing. The first sample was sent for testing on 18th of March 2024 this year, and at that time the Drug Control Department, which comes under Health Department, had reported that 2 batches of this IV solution were not suitable for use. That is, they were not of standard quality. 4 days later, on 22nd of March, the Health Department blacklisted 2 batches of this very IV solution. As soon as this report came out, in the company that supplied these 2 batches, they approached the Karnataka High Court on 4th of April 2024. The same day, the High Court issued a stay order. Even after the stay order, all IV solution supplies were used continually. Now, the IV solution that was not even tested for minimum quality was supplied to government hospitals. This is a negligence on a massive level. Now, despite the death of midwives and pregnant women, the sample test of this IV solution was still being done. According to the rules, remember, the sample test should be done immediately after the supply, but that never happened. However, only 95 batches of sample have been tested so far. The Drug Control Department reported that 25 batches of the IV solution were not suitable for use a week ago. Sample test of 100 batches of solution have not been conducted at all. So, of the 195 batches, only 95 batches have gone through testing and 25 batches have been found unsuitable for use. The question is, why is the unusable, unsuitable IV solution from these batches not included in the blacklist? And why are women in Karnataka, in Ballari particularly, being administered an IV solution that has not been tested, and in some cases an IV solution that is not fit for usage?